Hello everyone, and welcome to my channel. In this video, I'm going to talk about 8 warning signs of blood clot that you should never ignore. Blood clots are clumps of blood that form when your blood thickens and sticks together. They can occur anywhere in your body, but they are more common in your legs, arms, lungs, and heart. Blood clots can be very dangerous, because they can block the flow of blood and oxygen to your vital organs, causing serious complications such as stroke, heart attack, pulmonary embolism, or even death. That's why it's important to know the symptoms of blood clot and seek medical attention as soon as possible if you experience any of them. So, without further ado, let's get started with the 8 warning signs of blood clot that you need to watch out for. Number 1. Swelling. Swelling, also known as edema, is a common indicator of a blood clot, medically referred to as deep vein thrombosis, DVT. DVT occurs when a blood clot forms in a deep vein, usually in the legs, although it can occur in other parts of the body. Understanding the characteristics and implications of swelling as a symptom of DVT is crucial for timely diagnosis and intervention. The presence of a blood clot in a vein can obstruct the normal blood flow. As a result, the affected area might swell, becoming noticeably larger than usual. This swelling is often asymmetric, affecting just one limb, such as a single leg or arm. It may occur suddenly or gradually, causing discomfort or a feeling of tightness in the affected region. The swollen area might also feel warm, tender, or even painful to the touch. This discomfort can worsen when standing or walking. Additionally, the skin over the clot might appear red or have a bluish discoloration due to decreased blood circulation and increased pressure within the vein. Swelling caused by a blood clot differs from generalized swelling due to other reasons, such as an injury or infection. It tends to affect a specific area and might not respond to typical measures like rest, elevation, or ice packs. Early recognition of swelling as a potential symptom of DVT is vital. If left untreated, blood clots can dislodge and travel through the bloodstream to vital organs, leading to serious complications such as pulmonary embolism if it reaches the lungs. The second sign of blood clots refers to shortness of breath, which can be indicative of a potentially life-threatening condition called pulmonary embolism, PE. PE occurs when a blood clot dislodges from its original site, often in the legs, and travels through the bloodstream to the lungs, obstructing blood flow. When a clot lodges in the arteries of the lungs, it blocks the flow of oxygenated blood to a portion of the lung tissue. This blockage leads to decreased oxygen levels in the bloodstream, resulting in shortness of breath, chest pain, or difficulty breathing. Shortness of breath associated with a pulmonary embolism can vary in intensity, ranging from mild to severe. It might start suddenly and can be accompanied by other symptoms such as chest pain, a rapid heartbeat, coughing, or even coughing up blood. Individuals experiencing sudden and unexplained shortness of breath or difficulty breathing, especially if it worsens with physical activity or is accompanied by chest pain, should seek immediate medical attention. This symptom is particularly concerning if there's a history of recent surgery, prolonged immobilization, cancer, or other risk factors predisposing someone to blood clots. Healthcare professionals will perform various diagnostic tests, including imaging studies like CT scans, to confirm the presence of a pulmonary embolism. Prompt intervention is crucial as untreated or severe PE can lead to serious complications such as heart strain, respiratory failure, or even death. Treatment for pulmonary embolism often involves blood-thinning medications to prevent further clotting and allow the body to dissolve the existing clot. In severe cases, procedures like thrombolytic therapy or insertion of a filter in the blood vessel might be necessary to remove or prevent additional clots. Number 3. Sever headaches. The third warning sign of blood clots relates to severe headaches, which can be indicative of a blood clot in the brain, a condition known as cerebral venous sinus thrombosis, CVST. Blood clots that form in the veins within the brain can disrupt normal blood flow, leading to increased pressure in the brain and causing severe headaches. These headaches often differ from typical headaches and can be intense, persistent, and accompanied by other neurological symptoms such as blurred vision, confusion, seizures, or difficulty speaking. The severity and sudden onset of these headaches, sometimes described as the worst headache an individual has experienced, can raise concerns about a potential blood clot in the brain. Number 4. Skin discoloration. When a blood clot forms in a vein, it can impede normal blood circulation, leading to changes in the skin's appearance. The skin over the area where the clot is located might exhibit discoloration, appearing reddish or bluish. This discoloration is a result of the reduced blood flow caused by the clot, leading to poor oxygenation and accumulation of deoxygenated blood in the affected region. It might be more noticeable in the extremities, such as the leg or arm, where deep vein thrombosis, DVT, commonly occurs. Number 5 refers to coughing up blood, known as hemoptysis, which can signal a blood clot in the lungs, pulmonary embolism. When a clot dislodges from its origin and reaches the lungs, it obstructs blood flow. This blockage may lead to coughing up blood or blood-streaked mucus. Hemoptysis is a concerning symptom and often accompanies sudden shortness of breath or chest pain. Number 6. Dizziness or fainting. The sixth sign of blood clots involves dizziness or fainting, which could signify a clot affecting blood flow to the brain. When a blood clot disrupts normal blood circulation in the brain's blood vessels, it can lead to reduced oxygen supply and affect brain function. Dizziness often accompanies this situation, presenting as a sensation of lightheadedness, imbalance, or spinning. It can occur suddenly and persistently. In more severe cases, reduced blood flow due to a clot can cause fainting or loss of consciousness. Number 7. Unexplained fatigue. Number 7 involves unexplained fatigue, which can sometimes indicate an underlying blood clot, especially if it accompanies other symptoms. Unusual and persistent fatigue, beyond what can be attributed to daily activities or lack of sleep, might signal a potential issue with blood circulation. Unexplained fatigue linked to blood clots may not improve with rest and can occur suddenly or gradually. It might be a generalized feeling of exhaustion or lack of energy without an obvious cause. Number 8. Pain or tenderness. The last sign refers to pain or tenderness, often localized in the leg or arm, which can signify the presence of a blood clot. Deep vein thrombosis occurs when a clot forms in a deep vein, most commonly in the legs, although it can occur in the arms or other areas. The pain associated with a blood clot might be persistent, throbbing, or cramp-like. It often occurs suddenly and might intensify when standing or walking. The affected area can also feel tender or sensitive to touch. This pain or tenderness occurs due to the clot's impact on blood circulation. The clot impedes normal blood flow, causing increased pressure within the affected vein and resulting in discomfort or pain. Differentiating this pain from typical muscle soreness or injury is crucial. While muscle pain often improves with rest or specific movements, pain due to a blood clot might persist or worsen, especially when weight is placed on the affected limb. Preventing blood clots involves staying active, maintaining a balanced diet, and adopting healthy habits. Regular exercise improves blood circulation, reducing the risk of clot formation. Stay hydrated to ensure blood remains at the right consistency. Avoid prolonged periods of immobility. Take breaks to move if sitting for long stretches. For those at risk, compression stockings can aid circulation. Follow prescribed medications, especially if diagnosed with clotting disorders. Smoking cessation and moderation of alcohol intake also reduce risks. And that's it for today's video. I hope you learned something new and useful. Remember, blood clots can be life-threatening, so if you notice any of these symptoms, don't hesitate to call your doctor. If you liked this video, please give it a thumbs up and subscribe to my channel for more health-related videos. Also, feel free to share your thoughts or questions in the comments section below. Thank you for watching, and I'll see you in the next one. Stay healthy and safe, everyone. Bye.